Hi, I'm Dr. Mitchell Chasin, Medical Director of Reflection Center for Skin and Body here in Livingston, New Jersey.
Can you tell us what sort of procedure we're doing today?
Sure, we're going to be injecting hollow temples today. We're going to be using a dermal filler to increase the volume in the temples, and it's a very easy procedure, quick procedure, and one that is really, really satisfying to our patients.
How long does do the effects of the procedure last?
The effects of the filler actually last for years. It's an area that is wonderful to do because we don't have to keep repeating this every 6 months, 1 year, 2 years. It can last many, many years.
And who do you recommend this procedure for?
This procedure is done on women as well as men who lose volume in the temples. And that may be a genetic thing, or it may be something that develops when people lose weight. You know, we're pushing our weights to very low limits. We have low body fat, and one of the problems that ensues sometimes is hollowing of the temples.
So what will we see today from the procedure?
We're just going to see these hollows literally disappear in front of our eyes. And it's one of these effects that is very, very significant, but under the radar. Mm-hmm. Anyone else is not going to notice what we've done. Mm-hmm. People just look better, they look more rested, they look more youthful, and they look energized. Mm-hmm. But no one can point their finger at what happened, and that's really a great thing.
Any other procedures you might combine this with?
Well, when we look at volume in the face, we look at the cheek area, we look at the lower face, and we look at the temples. And very often we see loose skin that develops as a result of that depletion of volume. As we put that volume back, we see the skin look tighter, we see the proportions of the face improve. And again, we look healthier. So we're not putting volume where that volume never used to be. We're just replacing that lost volume. And thus people look completely natural.
What sort of prep do you have to do before getting the procedure?
We have people stay away from aspirin, Advil, vitamin E, and fish oil to try to reduce the incidence of bruising. But bruising with this procedure is very, very rare. Other than that, it's something that we do right on their lunch hour. They go right back to work, go right back to their activities with no downtime.
Amazing. Should we give it a try?
Sure, absolutely. So we are just going to rest your head back. This is nice and comfy. I'll lay you back just a little bit, okay? Mm-hmm. It's a very, very easy treatment. Very, very comfortable treatment. So you'll hear some popping sounds, maybe a little pressure, but you really shouldn't have any discomfort, okay? Mm-hmm. You should feel a little pressure here. How we doing?
Good.
Any discomfort at all?
Not now.
Good.
What does it feel like?
Little pressure. That's pretty much all I'm feeling right now. Mm-hmm.
This is a very, very safe procedure if done in the right hands, but there is knowledge of anatomy that someone must have when doing this injection. Mm-hmm. And without that knowledge, this can turn from a very, very safe, enjoyable procedure to one that is unsafe.
And is it comparable to any other type of procedure? Like, what's the difference between this and Botox, for example?
There are a bunch of blood vessels that live in this area that we want to avoid. Mm-hmm. So knowledge of the anatomy is critical. Mm-hmm. This is something that only should be done by a physician who is competent in these injections and doing these injections all day long. Mm-hmm. And as we can see here, we've taken out the hollowing. You know, this now, the proportions have been replaced to, have been normalized. So what happens as we hollow and the body sees the body reveals this bony prominence here. Mm-hmm. And when people see that bony prominence, the eyes look closer together. So as we fill that volume here, the eyes look further set apart, which is more pleasant, and we actually get a brow lift a lateral brow lift where the outside part of this brow comes out.
Wow.
And it should look like we've never done anything. It should be completely what I call under the radar.
How are you feeling now?
Fine. Feels good. Fine. I don't feel anything really. I mean, when he, is injecting, you feel the pressure, but it's not uncomfortable at all.
Almost done with this side, okay?
Mm-hmm.
So what are you doing right now? Just
We're just filling in the rest of the, and that is completely done now. So you can see that the contour is beautifully straight. A little redness more from my rubbing than anything else. There's no bruising, and she really won't have any swelling.
It is so noticeably different, but I mean, you wouldn't know it unless you had the side-by-side comparison.
And she will see this brow over the next week. This brow will lift from this. Let's do the
A lot of
other
people are
side.
saying they can't wait to get it.
Okay, we're about to do the other side.
Right.
So you can see the howling. I'm not sure how it shows on camera.
Yeah, you can definitely see it.
Okay, I'm going to slide you towards me a little bit.
That's good.
So here is the howling. Could I just have a pen and just outline that? So here's the howling.
Okay.
And here's the deepest part. And a lot of celebrities have hollow temples, which is interesting because they're putting lots of volume, whether it be fillers or transferring fat into the face, and their faces are looking terrific, but they're ignoring the temple. I just saw last night Tina Fey in a commercial, and her hair is pulled back, and you see this howling. It really does. It makes someone look unwell when they're not unwell. Here we go for the next side. Ready?
Mm-hmm.
There we go. Feeling okay?
Feel fine.
Nice and slow. Where we inject way down deep, there aren't any blood vessels. So it's a very, very safe place to inject.
We have Michelle asking what is the name of the product?
So we're using here Juvederm Voluma, which is a long-lasting filler made out of hyaluronic acid. Hyaluronic acid is one of the building blocks of the skin, so it's a filler that we don't have any issue with allergic reactions. It's the longest lasting hyaluronic acid filler made today. And we probably won't need to do this again with Cindy for many, many years.
And we have a question, what is the age recommendation for this procedure?
This can be done at any age. The youngest I've treated individuals was 18 years of age, and there we see it as a genetic trait. And I've treated people into their 90s for this. And again, we see it very often in people that take better care of themselves, that are dropping their body weight to low levels.
We have Nandita asking if you could remind us what we're doing since she just joined the broadcast.
So we are injecting Juvederm Voluma into the temples to remove the hollowing that we see. That improves the proportions of the face. It gives us a nice little brow lift. Can we have the other?
We have Amber asking if it can be done between the eyebrows in a furrow.
Yes, so we can use filler into the deep creases in between the eyebrows. That's an injection that we have to do very conservatively and very slowly, because though it's a very rewarding injection, it is an injection that can have risk. So that has to be done in the right hands, very conservatively, very slowly, and it has a lot of rewards.
Michelle said she had this done under her eyes for Halloween. Can that be done as well?
Yeah, very commonly we'll use dermal filler into the temples as well as under the eyes. One of the causes of darkness under the eyes, or what people call dark circles, is actually hollowing. So the use of dermal filler under the eye is a great way to take out those dark circles.
Wow.
Sin, you're doing awesome.
And she had a local anesthetic before this?
No.
No?
No. This is done. We mix a little bit of local anesthetic in with the filler, but there was no injection of local anesthetic done properly. So this is a very, very comfortable treatment, as long as it's done very slowly, very methodically. Very comfortable.
So we have somebody asking, and I'm not sure if this is what this means. Does Valium help to prolong the effect like it does with Botox?
Valium does not help to prolong the effect of a filler, nor does it prolong the effect of Botox. Almost done here. A little bit of swelling, not much.
And this procedure is available across the country if some of our viewers are not in the New Jersey area.
So this injection is an off-label use of this product, so it's something that is okay to do, but again, it needs to be done by someone that is doing injections all day, that's comfortable with this injection. Again, it's an injection that is very safe in the right hands, but in the wrong hands, it is something that could have some risk, so that's really, really important. Some of the other injections into the cheeks or into the folds are ones that are better for novices if they're starting out. But the temple injection is, though it looks really easy, there's specific an anatomy that we need to know to make this a safe and successful injection.
We have lots of people saying you're very calm.
Well, you really don't feel anything. I mean, you hear a little crunching, a little like squirting, but you don't feel anything. You just feel a little pressure. So it is it's very comfortable procedure.
And we have questions about the price.
So filler cost in the United States probably for Voluma can range anywhere from probably $800 to $1,000 per syringe. For regular Juvederm, probably anywhere from $600 to $700 per syringe. Depending on how much volume is lost, one may use anywhere from 1 to 3 syringes. But again, the big advantage here is that this effect will last for years and years. This is not something that typically has to be redone once a year.
Jan is asking if the filler is gluten-free.
Yes, the filler is gluten-free for those out there with celiac.
Leslie wants to know, can it be done on the wrinkles on the neck?
Filler is not great for wrinkles on the neck. It is, for wrinkles on the neck, we usually are using technologies or lasers to tighten the skin. So fillers are not a great use there.
And what about the upper lip?
Upper lip, we tend to use very, very superficial fillers, something called either Bellatero or something called Restylane Silk. And there we're able to inject very fine lines. The other thing that's important in the upper lip is to recreate the support of that upper lip. So we normally use something called a cannula, which is a non-needle, and inject horizontally across the lip. And we're not looking to make that white part of the lip bigger, we're trying to make that skin stronger. And what happens, I mean, Cindy has a beautiful upper lip, but in people where their lip is collapsing, causing those lines, as we inject sideways, the lip re-expands and those lines reduce. So it's really important, in addition to just injecting superficially those fine lines, to recreate that structure of the lip. Again, we're not looking to make the white part of the lip bigger. We just want to make it stronger.
Got it.
I'm just going to use some ice now. And now, the last part, we just have Cindy just put a little bit of ice, but you can see she'll be able to go right back to
Can barely notice it.
to work, and no one will know we've done anything.
Can you? What do you recommend? Can you put makeup over
You
that?
could put makeup on immediately,
Okay.
and she won't have any bruising. She really won't even have any swelling. And if you feel with your hand, if done well, you shouldn't feel anything. So I tell patients their quality assurance before they leave the office, take their hand and run it over the area where a filler was done. You shouldn't be able to tell that anything was done. It should feel completely smooth. If it doesn't feel completely smooth, we want you to ask the treating physician if they can take a look at that. Because if they by any chance left an area that's not smooth, it's easier to fix it right at that time than later on.
So it's better to ask before you leave the
Absolutely.
office.
That's your QA, that's your quality assurance. Just take your finger, rub it over the area and say, can I detect that anything was done? And the answer should be no. Hopefully
Smooth.
it's no.
Smooth.
Vivian's asking, did you use the whole syringe? You used 3 full syringes.
We used 2 full syringes. One of the things we do here is actually mix a little bit of local anesthetic into the filler. That makes the filler inject more smoothly and also makes the treatment completely comfortable.
Wow. All right. Cindy, you're still feeling good?
Yeah, I feel good. It's the most relaxing part of my day, probably.
And then you're just, how long do you have her sit here for usually?
Just a few minutes.
All right.
And she should be fine.
All right.
So, again, this is an area that very often others notice that our temples are hollow, but oftentimes patients don't notice it in themselves. Hairdressers may point it out to their clients. The hair do that people sometimes have cover up those hollow temples. And they notice they look better, they look softer, they look younger, they look healthier when their hair is pulled forward, but they never realize the reason for that is that the temples are hollow. So when we do the temples, they very often now change their hairdo into something that they prefer. So it's an incredibly satisfying treatment.
Absolutely.
And again, one that has pretty profound results, but one that no one will be able to put their finger on what happened, even the closest relative or friend.
Absolutely. All right. Stephanie wants to know if there are any risks.
There are, when done properly, again, this is a very safe procedure, but there are blood vessels that live in this area that a physician needs to be keenly aware of. If they're not, and we inject this filler in the wrong depth, in the wrong what we call tissue plane, there could be very, very significant complications, such as blindness. So it has to be done properly, and if it's done properly, it's incredibly safe.
Awesome. Can we get one last look at Cindy before we sign off?
A little bit of redness and swelling from the ice, not from the filler, though.
Yeah. It's amazing. You can totally see the difference.
Yeah.
Dr. Chasin, thanks so much for being here with us today.
Thanks to everybody for being here.
Thanks, Cindy.
Thank you.